COVID-19 numbers in the national capital has spiked yet again. Delhi Health Minister today said that the COVID numbers in the last 24 hours might have crossed the 14,000 mark in the national capital. Now, the most important aspect about this particular surge due to the Omicron variant is that a majority of these patients are actually in home isolation in the national capital. Right now, I am at LNJP Hospital and I am joined by Medical Director of the hospital, Dr. Suresh Kumar. Sir, I want to understand from you, a majority of people in Delhi are in home isolation. So what are the do's and don'ts that people must follow while they are observing home isolation, and also for their family members?
This is a very important and crucial question because majority of the patient in this Omicron variant, which is spreading very fast, very rapid, and 3 times more common than the Delta variant. We have seen that the elderly population, even the normal adult population who are at their home, in home isolation, they must know what to do and what not to do. So they must self-monitor their vitals, blood pressure, oxygen saturation. Oxygen saturation is very, very important in the corona management. They have to see if oxygen saturation, pulse is normal, blood pressure is normal, and oxygen saturation, if it is more than 95%, then there is no need to rush anywhere. They can stay very safe at their home. But if oxygen saturation is less than 95 or 94, they must go to the nearest hospital. They must call the ambulance even in the middle of the night because oxygen level is very important and that has to be maintained. Right. Second early warning sign is the high-grade fever. If you have a high-grade fever, don't wait. Consult your doctor. But what not to do, that is also very important. Right. So one must not take self-medication. We have seen in the last wave that the large number of patients were consuming steroids even without prescription. So never self-medicate. Always consult the doctor before you take any medicine. Right. Even paracetamol can be harmful if it is taken in the large quantity, or overdose of paracetamol we have seen. That don't take crocin or paracetamol too frequently. That is very important. Take paracetamol if temperature is more than 100. If you have simple 99 fever, don't take paracetamol. Okay. That is one. Don't take antibiotic and steroid without prescription. That is also very important. And lastly, if you have any uneasiness, any untoward symptoms, always rush to the hospital. Right. That is very important. We have seen that saturation sometime gradually coming down, and they said, "Hum subah jayenge, morning mein jayenge." Nahi, it's too late. If oxygen saturations fall below 94%, immediately rush to the hospital, nearest hospital. That is very important.
Okay. So one more question. During the second wave, we had seen not only people going ahead and taking having self-medication, but also people taking steams, and then we had cases of nostril burns and all that complications started propping up in the country. So when people are in home isolation during the Omicron variant, how to steam, how many times people must take steam, and what sort of within the home isolation, what sort of social distancing must be maintained within the house?
Yes, very right question. You have seen that excess of everything is harmful. We have seen that people have taken steam 8 times, 9 times, every hour they are taking steam, and they have inflicted self-burns. We have seen the airway injury, the nostril burn. We have seen many cases that people are not maintaining the temperature, and every time they think that steam kills the virus, and they are taking more and more steam. It's not true. You have to keep a temperature at optimum level. You have to take steam with the proper steamer, and at the same time, you have to take it 3 times or 4 times, 8 hourly. If you take excessively every hourly, that is not going to be helpful. Rather, it is counterproductive and may harm your airways. Right. That is very important. Right. And you have to keep the temperature at the optimum level.
Right. And within the house, like there are people who are infected because of the COVID-19 and there are people who are not infected. So what sort of distance must be maintained within the house?
You see, Delhi, we have a lot of, the living area is very small. There are large families, people live in a single room, and sometimes it is not possible to have a separate toilet, separate room. So this is very important that you use the mask. And distancing, social distancing is mandatory, very important, very effective and preventive. But at the same time, we have to see the social structure, and we have seen that a large number of population can't afford that. But what we can do is at least mask, simple mask, cloth mask, always should be used in the house.
I was coming to that question, sir. Now that we are seeing a surge in the COVID-19 cases, and Delhi Health Minister Satyendra Jain said that the most potent weapon that we have against the virus right now is using mask and following COVID appropriate behavior. So I want to understand, this time around we have a new variant. So what sort of mask is preferable, and whether uses of simple cloth to cover the nose and mouth would be effective?
There are multiple studies on it that the use of N95 mask protects more than 95% of the spread of infection. But at the same time, we have seen that the other masks, simple triple layer mask, the simple cloth mask, they are also very highly protective. And if we use N95 mask, it's good, but it is mainly used by the healthcare workers, doctors, nurses, frontline workers. But if you can't have this N95 mask, other mask like simple triple layer mask is equally good, and the rate of protection is much, much higher. And if you even don't have the mask, you can use the simple cloth, but that mask made of a cloth must be washed daily. Last way we have seen that people were using the cloth mask for 4 days, 5 days, and it had created some problem. So through you, I am just giving a message that clean mask, clean cloth mask is very good, and it can be used very safely, and there are many studies that this is very, very protective.
Okay, sir. One last question. We had seen that several healthcare workers in different Delhi government hospitals in Delhi have started to test positive of COVID virus in the past week. What is the latest number at LNJP Hospital?
20 of our staff is so far infected. We have 9 sisters and doctors, 11 doctors, total 20 persons are in home isolation, or they are in the separate facility. And this is a bit alarming situation that doctors, nurses are also getting the infection, and it had a definite impact on the efficiency, because if our number is less, and then we have to get the replacement. And we are hiring more and more staff to make the services very smooth.
Okay, thanks a lot for speaking to us. So that was Dr. Suresh Kumar, who is saying that in the past few days, LNJP Hospital alone has witnessed 20 healthcare workers testing positive of COVID-19. Along with that, he also underlined the fact that now that the cases of home isolation are increasing in the national capital, we must make sure that we monitor our oxygen level, and along with that, we must not self-medicate. With video journalist Shagun, this is Amit Bhardwaj for India Today from Delhi.